When evaluating the patient's range of motion, if we look at active, passive, and resistive range of motion, we can evaluate the myofascial tissues for strain and the joint tissues for sprain. Let's talk about what these three terms mean. Active range of motion is when the patient does the motion that you ask them to do on their own. So would you rotate your head to the right, please, Deb, as far as you can? Now that's active range of motion of right rotation. Passive range of motion is when the clinician moves the joint through its range of motion passively without interplay of the patient. So I'm going to move your head to the right, Deb. You let me do it, okay? This is passive right rotation of the cervical spine. The most accurate way to measure a joint is with passive range of motion. Because what happens sometimes with active range of motion, if the patient has a muscle injury, they will guard and won't go as far as the true movement is. And lastly, with range of motion, you can do resistive range of motion and look for pain with resistance or without pain. So Deb, would you rotate your head to the right? Now I'm going to put my hand on her chin and hold that and resist her movement. That's good. And then I'm going to ask her if that causes her any pain or not. In evaluating a patient for a strain or injury to the muscle or a sprain, injury to the joint, by doing active, passive, and resistive ranges of motion, we can differentiate between these two diagnostic entities. If we differentiate between these two, our clinical treatment can be more specific, improving the prognosis of our patients. So let's evaluate a patient with a sprain. We start with passive range of motion, then we'll do active range of motion, and then we'll do resistive range of motion. With passive range of motion, we have the patient move their head with the doctor moving it. Okay, so I'm moving the head, and this is passive, and I ask the patient if it bothers them. In a sprain, that will be positive because we're moving the joints. Then we have the patient move their head actively. So you rotate for me, Deb, to the right, and go to the left, and ask them if that bothers them. In a sprain, that will also bother them because we're moving the joints. Now we're going to check resistive range of motion and check for the integrity of the muscles. So will you rotate your head gently against my hand? Relax. Let's do this way, gently against my hand. Now, if that does not cause pain, and we have pain with both active and passive ranges of motion, now what we have is a sprain. Let's evaluate a patient that has just a strain. We're going to start with passive range of motion. So I'm going to move the patient's head in rotation and ask them if it bothers them. In a strain with passive range of motion, that will not bother them. Now I'm going to have the patient do it themselves for active range of motion. Will you move now? Okay, will you move this way? With active range of motion, we're moving the muscles which are injured, and that will cause them pain. Now we're going to do resistive range of motion. Rotate to the right gently a little bit, and to the left. If that causes them discomfort, we know we're dealing with a strain because we're causing contraction of the muscles, and if the muscles are injured. Now, we've done rotational maneuvers. In your patient, you may need to do extension maneuvers, or you may need to do flexion maneuvers forward to identify the area of the muscles involved and the joints involved. With doing active, passive, and resistive ranges of motion of the cervical or the lumbar spine, wherever the patient has their chief complaint following trauma, you can identify whether the patient has had an injury to the ligaments of the facet capsules, or whether they've had an injury to the muscles or the paraspinal muscles, as in strain, or both.